try to prevent the fall, because fall during elderly age is one of a very high risk problem. Many times the elderly people is falling down, and the most common place is in the toilet. So when they fall in the toilet, the common place where they have fracture is their hip bone, the neck of femur fracture. When the protein intake is less or the nutrition level is low, it can lead to osteoporosis. Hi everyone, myself Dr. Prakash here. Today I am going to explain what are the common reasons elderly people have a fall at home and how to prevent it. So this is a very important health topic everyone should know, and you have to share with your elderly people at home. So the number one is you have to monitor their blood pressure, because if the blood pressure is low or the blood pressure is high, this can cause dizziness among elderly people. This is one of the common reason. And number two is hypoglycemic. If the sugar level is low, this also can cause a fall during the walk in home itself. And number three, the medications they take. Sometimes they take medication without proper monitoring of their diabetic and blood pressure, or sometimes they take medicines which can have drowsiness. So this also is one of the more common reason. And number four, they have to monitor their muscles and also the bones. If they have muscle weakness or bone osteoporosis, osteoarthritis, this also can have a instability in their walk. So you have to do proper assistance. Either you should, when they move around, you should be there should be a person to support when they walk, or when they are walking, you should give them a proper crunches or sticks which can give them a external support for them to prevent the fall. And number five, the floors. If they are walking inside the house or if they are walking to the toilet, make sure the floors are not still slippery, because slippery floor is one of the main reason many times the elderly people is falling down, and the most common place is in the toilet. So when they fall in the toilet, the common place where they have fracture is their hip bone, the neck of femur fracture. So this is one of the very common reason. So make sure the floors are not slippery. And number six, make sure the lights are bright, because sometimes if the lights are very dull, if they don't have a proper eyesight, or the flow is not bright enough, this also can lead to fall. And number seven, when they are walking or moving around, make sure the nutrition support is good. They should take proper protein, their calcium level should be good, and their vitamin D level should be good, because when the protein intake is less or the nutrition level is low, it can lead to osteoporosis. The bone density will become lessen. And number seven, they should make sure that they have any other diseases like Parkinson's or stroke. During this time, without their knowledge, they even feel weak and suddenly they might fall. So these things you should make sure that they should always be monitored and assisted when they are at home, and try to prevent the fall, because fall during elderly age is one of a very high risk problem. And if say you want to have any consultation based on that, or you want to know about the nutritional blood test, you can contact us. And also if you are having elderly people at home and you have a challenge of giving them a 24/7 care, you can contact us, because in our nursing home in Majestic Life Care Palace, we are giving them 24/7 care, and also we make sure their nutrition is well balanced and they are given a proper medication and also monitoring of the vitals every day. So if you have any doubts, you can contact us, and you can give a message to the below number. I will be replying personally, and we can discuss over the WhatsApp or call. Take care. Bye.